Hi, I'm Helen Bauer, and this is the Heart of Hospice podcast. The Heart of Hospice podcast is your source for compassionate and informative discussions about hospice and end-of-life care. I'm a certified hospice and palliative care nurse with over 15 years of experience. Whether you're a caregiver, someone with a serious illness, or you simply need to know more about hospice care, this podcast is for you. Join me as we explore all the aspects of hospice, from the details of caregiving to the emotional and spiritual dimensions of end-of-life journeys. For more resources and to connect with me, visit theheartofhospice.com and find us on Facebook, Instagram, and LinkedIn. Keep listening for today's episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This episode of the Heart of Hospice podcast is being sponsored by bkbooks.com. Barbara Carnes and her team at BK Books have created the Approaching Death Support Kit to help educate and support families with clarity and compassion. This new bundle is a practical, ready-to-use resource for the bedside and includes many of Barbara's most trusted booklets. For more information, visit bkbooks.com or see the show notes for the link to bkbooks.com.
Today's Back to the Basics of Hospice episode is focused on-call or after-hours services that hospice provides. I'm excited to have Gabby Jimenez of the Hospice Heart back for a conversation about the 24/7 after-hours service that hospice agencies provide for patients and families. Gabby's a hospice nurse and a death and dying educator, as well as an end-of-life doula. You can find her classes, blogs, and books at thehospiceheart.net. When you're caring for someone with a serious illness, it's good to know that your hospice team is there to support you no matter what day it is or what time it is. And that's what we're talking about today, after-hour services and on-calls. So stay with me for this great conversation. There's a lot to learn. Gabby, welcome back to the podcast. It's great to have you back with me.
Thank you for having me. I'm very happy to be here.
I love these Back to the Basics episodes that we're doing because I really feel like it brings up some old skills that I haven't used in a long time and helps me remember what I have forgotten about hospice care. And I think it's really informative, not just for hospice workers, but for patients and family caregivers as well. So thanks for doing this with me.
My pleasure.
Okay, so today we are talking about after hours or on-call hospice services, which is a really important component of hospice care because access to hospice care is 24/7. Super important for a patient and family to know that they've got that round-the-clock, 7 days a week, every single day of the year, Christmas, New Year's Day, Thanksgiving, that support is there. So I want to talk about what is on-call? How does that set up? And how do you use it? So let's start with what it is and what's available.
All right. So when you start hospice, one of the things that we will tell you, especially at admission, is that the minute you sign that consent and we provide these services for you, we are available to you 24/7. So when you call Monday through Friday, 8 to 5, you will have a triage person answer the phone. That person is usually going to be there to redirect you in whatever way you need to be cared for, right? If you're calling because of symptoms, if you're calling because of questions, if you're needing a social worker or a chaplain or a home health aide or a volunteer or whatever you're needing, that person can help you with that. After hours and weekends and holidays, the hospice offices are usually closed, but the phone is always open. Some might hire a service,
Right.
but in our case, in the hospice that I have worked at, they had live people that took your calls. So when you call in and you say, for instance, especially after hours, my person has had a change of condition, or this has happened, or this has happened, that person who is answering the phone is a nurse. They are a triage nurse, which is trained in responding to pretty much any question you have. Now, I'm going to go back a step just to give you some clarification. When you start hospice, usually most hospices will send to your home a kit of medications. Some call it a system relief kit, some call it a comfort kit.
Right.
The whole purpose of this, some you will use a lot of, some you will never touch. It just depends on what your person's going through. But the purpose of this is in the event that your person is having symptoms of some kind: pain, shortness of breath, agitation, restlessness, confusion, nausea, vomiting, right? This kit will address that. And what you can do is call our 24/7 triage line. And because they know that that kit is in your home and they know how to use it, they can often give you the information, the directions, the instructions, the guidance, and the support to reduce the symptoms of whatever they might be experiencing. Now, after hours, weekends, holidays, staffing is less, pretty much in every company. So oftentimes you might call and they might say, try this morphine, give it again in an hour if it's not effective, and then call us back. What that does is that gives them time to help other patients in need, and hopefully what you've given will work. They might suggest that you reposition or elevate the head of the bed. They might just give you guidance to respond to whatever they're going through. But if it's about medication and they encourage you to give something out of the bag, the first thing I want to tell you is to not panic. What you're giving is not enough to end a life. They are guiding you to use a very small amount, which we call, say, a PRN, which means as needed. This is a small amount that will address most symptoms. Again, it's not enough to end a life. So they will try to do this over the phone because, again, staffing is usually an issue. So I want you to trust them. So if you're the one making the call, first of all, I want you to trust them. But I also want you to feel confident and comfortable with saying you are afraid or ask for the why. Because I think we need to know what we're doing to someone we love, what we're giving to someone we love. So you have every right to ask these questions. Hospice is not the boss of you. So you can find out what is needed. You can ask for more education if you're not quite getting it. So let's say this happens. Your person has shortness of breath. They suggest you give a little bit of morphine. You try it. You were told to give it again in an hour if it's not effective. You tried it again, it didn't work. So you call the hospice back. Hospice says, okay, we'll send a nurse. Now I need to be very straight up and forward with you. Oftentimes they can get right there within an hour. Sometimes it could take longer, especially if they don't have a full staff or they're with another patient. So this is when I want people to be comfortable with the medications and the trust they get from that triage nurse, because they are wise and they are full of so many resources. So when you call, there is a pattern that you have to follow. You call, you tell them what you need, and they will find someone or something to remedy whatever it is you're calling for. But after hours and weekends, which some people call after hours, some people call it triage, some people call it on call, are your backup plan. The reminder that you're not alone, even at 2 a.m. I think that does that sum it up pretty well, do you think?
Yes, perfectly. I think emphasizing that when they say 24/7, they're not kidding. There is somebody available. There will either be a triage nurse or the actual nurse who is on call available to you by phone. That's going to be the first interdisciplinary team member, because I think the majority of the calls that come from people who are on hospice are for a nurse, right? They're looking for clinical advice. We do get calls that are simply questions. We get calls that are requests for a visit. So in my work experience, one of our unspoken rules, one of our practices was one call is fine to answer over the phone if they have a question or a concern. The second call comes, even if you're answering the question, you still go out and make a visit. And that's that's really a good rule of thumb, because if they're just calling to get information, or they're, the caregiver is concerned about things, if you haven't been able to alleviate their anxiety in just the one phone call, then maybe your presence is going to be more effective. That gives them a chance to ask further questions, gives you a chance to really assess and see how they're doing with things. And there are other disciplines available after hours as well. So what the regulation says, I always fall back into I put my regulation hat on. All our services are to be available 24/7 every day. So if there is a death in the home, so say a patient has passed away, the loved one calls and says, my person has died, I need help, I need whatever, they're going to send a nurse, either an LVN or an RN, according to what the laws are and the company policy is, to come and pronounce death and take care of the business side of things. They can also send a chaplain or a social worker to provide grief support. So it's important to know that those team members are also available to you 24/7. If you called and said, my person is dying and there's another family member here who has become overcome with grief and I need help, we need grief support while this is happening, can you please send a chaplain? That is a service that your agency, whether you are working for it or you receiving care from them, that agency should be providing.
Unfortunately, with staffing, sometimes there are issues that might make it impossible to get someone there right away. But relative to the chaplain, one of the things that I really love that our chaplains offer is the ability to bring in someone from the church to do the anointing of the sick, or say the last rites. I'm not quite sure how that's done necessarily, but I love that we can do that we can offer that. So even I had a patient who said similar to what you were sharing, which the person called and said, my person is dying and the family's having a hard time and we're needing that extra support. But what they wanted was for someone to come to the bedside and pray and offer the anointing of the sick. And while our chaplain was unable to get to them personally, he reached out to their church of choice and was able to get someone to go out there. I love that we have these connections that allow us to, if we can't be there personally, that we can have someone else come. And the other person that is also on call 24/7 is the doctors, our hospice medical director. And it may not be the doctor that you've been assigned to, but there is a doctor available 24/7. So if there are symptoms and you call the triage nurse has access to them. There's been cases, we had a doctor specifically who was amazing and worked 24/7. And in the middle of the night, he would call the family directly just to reassure them. And has in the past actually gone out there when things were so tough for all of them. In general, when you think of hospice is a team. We're not a solo act. We are a community of people that have come together to collaboratively provide support to you. And we're all available to you. And it may not be the nurse you saw that day or the doctor you've been speaking to or the chaplain that you have a relationship with, but there is always somebody that can address your needs. So my message would be, don't hesitate to call your hospice. And if for some reason you can't get through or whatever, call back. It is important that you have that confidence in your team, knowing that we're all there for you in whatever you are experiencing.
I want to pick up on something you just said about calling back. I want to focus on this for just a second because I think that's super important. With hospice patients, there is not the luxury of time to wait until you get an answer, or until you get a call back, or until somebody can make it out there. My rule of thumb is I recommend to patients and caregivers, if you have not had a call back and had a conversation with a nurse who can answer your question within 20 minutes, you call back. Messages get dropped. I get that. It happens. So you call back. It's really important to be an advocate. And if you are a hospice nurse, team member or triage nurse, cell phones being what they are, you should be able to make a call out. And if you can't, you tell that triage service when they notify you, I'm in an area where my cell service is bad. Can you call that family back, or can you call whoever the backup on-call staff is to make sure that the question or the need gets addressed as quickly as possible? Our patients don't have the luxury of time to wait for us. And they certainly don't have the luxury of our mistakes. They don't have time to wait for us to remember that we forgot to call you back and then 3 hours later call you back. That's not a thing with us. I am loving this conversation, but we're going to take a break right now. There's more to come.
This episode is being sponsored by bkbooks.com. If you're caring for someone at the end of life, whether you're a hospice professional or a family caregiver, you know how important it is to have the right support and information. Barbara Carnes, award-winning end-of-life educator and hospice pioneer, has created a bundle of booklets that's an essential resource for anyone supporting a dying person. The Approaching Death Support Kit from BK Books offers practical guidance and compassionate insights that ease fear and help caregivers know what to expect during the dying process. The bundle includes many of Barbara's most trusted booklets: Gone From My Sight, By Your Side, The 11th Hour, Pain at End of Life, and her newest title, Always Offer, Never Force, and more. All designed to gently guide families through one of life's most sacred and challenging moments. Whether you're a nurse, social worker, chaplain, or end-of-life doula, this kit is a powerful tool to support your work. And if you're a family caregiver, this was made for you too. These resources offer compassionate answers when you need them most. BK Books offers quantity discounts for teams, agencies, and families. So visit bkbooks.com to explore the Approaching Death Support Kit. See the show notes for this episode for a link to bkbooks.com.
So what kind of situations would necessitate a call and necessitate a visit? Let's talk about some of that, because I think people are hesitant to call because they don't want to wake anybody up, or they don't want to bother anybody, or they want to wait until the office opens the next morning. And there's no reason to do that. Hospice is set up so people can access us quickly. So what kind of situations would really necessitate a call?
Good question. I want to step back just for one more moment to what you were saying about calling back in 15 minutes. I want to recommend to any hospice agencies that are listening right now to, especially if you are short-staffed, to invest in another backup service that can pick up your call. Because what people don't realize, to them it's a job. I get it. But to the person who's making that call, this could be moments before someone they love is about to take their last breath. And even though they've had all the time in the world to prepare for it, it's as though they've never knew this was coming. And the shock is there. The fear is there. The intensity of everything is there. And we have to be mindful of that. So when they call us and either no one answers, or they say, we'll call you back in 15 minutes and don't, I understand. Like you said earlier, short staffing is a thing. We've all experienced that. Right. Then we need to have a backup plan in place, a human voice, not a recording, a human voice that says, I got your message, I will pass it on.
Right.
Because that person needs to know that they did everything they could for their person. So when they call, sometimes, and you said it too, sometimes they'll call and say, I should have waited till tomorrow, but I just didn't know. You should never wait till tomorrow. There is no dumb question. There is no silly question. There's no unnecessary phone call. When someone you love is dying or someone that is in your care is dying, there is a lot of unknown. And the beautiful thing about our triage teams, the after hours, the on call, is that they probably have an answer that can alleviate it. So you could be calling because they threw up twice. You could be calling because they're spitting out their medications. You could be calling because a wound opened up. You could be calling because their breath has changed. Or maybe they have apnea, right? To someone who doesn't know what apnea is at death, that's when someone holds their breath for a moment. And at that moment, you think this is it. And then they take a deep breath again and you're thinking, whoa, what just happened? But for that moment, you're thinking, and the reality of what could happen is happening. There's panic. You make the call. Even if their breath is back to normal. This just happened. What does this mean? Or they've got the bag of medications. They've been told to how to use it, but now it's coming down to actually pulling out a syringe and drawing it up. And how do I do that? I don't want to bug the 24/7 nurses. Bug the 24/7 nurses.
Exactly.
Right? And if they're in pain, if they're vomiting, if they're confused, if they're slurring their words, if there's been any form of change in condition, you call. If the hospital bed remote doesn't work, you call.
Oh, that's a good one.
Right? If the oxygen concentrator stops, call them. It's anything. It's we're out of diapers. We only have 3 more. Now, I can't guarantee that you're going to get a package of diapers in the middle of the night. You might be able to if they have if a nurse has some in her car, but at least they can put the order through or let your case manager know that you need them and get them delivered to you. Or what if you realize you only have 1 more tablet of Ativan and he's going to need 2 by tomorrow morning? Often, hospices are connected to a med source that can get that delivered to you. Obviously, we want you to order those refills more so in advance. Please do that.
Yeah, please.
But I guess my point being is that when you are at the bedside caring for someone who is at the end of life, we want you to think of us as your emergency contact for anything. And maybe you'll get an answer just from that first call. Maybe they'll have to come out. But either way, the thing that we want you to know the most is that we hear you. You have been heard. And we want you to know that we are advocating for both you and the person you're caring for in the beautiful way that they deserve. But we're not mind readers. And if you don't tell us what's going on, we won't know. We can't fix it if we don't know what it is. So we want you to be clear and maybe repetitive and maybe call about something silly. I brushed his teeth and his gum bleeds. Oh, please don't brush his teeth anymore. That's hurting him. But what if we just give you that peace of mind or the reminder that you are not doing this alone? That's what on call, after hours, triage, 24/7, all of that, that's what we're here for. We are here to make sure that your questions are answered.
How about falls? That's a big one.
Oh,
if your person falls and you think they're injured or they have a skin tear, which is very common among hospice patients, give us a call. Good. We're going to give you instructions to tide you over until we can get somebody out there to have a look at them.
Absolutely.
So in summary, no question is stupid. We don't mind answering it. Yes, you may have to make allowances for our travel times and how things are staffed on the weekends and after hours, but we're here to listen to you, answer your questions, encourage you, ease your fears, bring you the supplies that you need, even though we still hope you inventory stuff during the week. Ask during the week, please. But Hospice 24/7 through on-call services is really one of the most beautiful and essential pieces of end-of-life care that hospice can offer. On-call can do some amazing things.
even just to relieve your peace of mind. Like, don't be afraid to make the call. You're not, you know, people say this all the time. We don't want to bother you. You know what? That's our job.
Yeah, it doesn't bother us. This is
It
what
doesn't
we
bother
do.
us.
We expect to get these calls.
Yeah.
We expect to get these calls. And we would much rather that a patient or a family call with a question than either put things off and have somebody be miserable or uncomfortable, or sit in there with fear and just stay there. Oh, I'm going to wait till my nurse comes 3 days from now to ask a question about a symptom. Don't do that. We're happy to talk with you, and we're happy to make a visit. We're happy to make a visit.
Yeah, you're not bothering anyone.
No, you're not. Gabby, you're wonderful to have these conversations with. I'm so glad I'm getting back to the basics with you. Where can my listeners connect with you?
You can find everything you need about me on my website, which is thehospiceheart.net. I have my classes, my blogs, my podcasts, my books, and also the link to the Facebook page. So you can find everything there.
Awesome. I'll have a link to it in the show notes so listeners can go straight in and get there. Thank you so much for being with me today.
Thank you for having me.
Thanks for listening to the Heart of Hospice podcast. Check out our sponsor in the show notes, and please leave a rating and review on Apple Podcasts. We would appreciate it if you would share this episode with your friends and family and anyone who needs to know more about hospice. Connect with us on Facebook, Instagram, and LinkedIn. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.